everyone, thanks for tuning in. This is Shannon with Shannon and Veronica Know Everything Medicine. So today we're going to be talking about heart murmurs. When we talk about heart murmurs, these can be found on incidental discovery, just on physical exam, or heart murmurs can be found based off of symptoms, and the heart murmur aligns with the underlying pathology with the symptoms. So there's several different kinds of murmurs. The ones we're going to focus on today are 4 of them. It's going to be aortic stenosis, mitral regurg, aortic regurg, and mitral stenosis. So the reason we're not going to focus on tricuspid is because these are less malignant, and pulmonic because these are less malignant, and I would assume less common if we're not talking about them. I don't even know. So just to show you the 4 patterns, you can see here, the first one is aortic stenosis, is a crescendo decrescendo systolic murmur, and then this is S1, that's S2. S1 is the AV valves closing, S2 is the semilunar valves closing. So this is systole and then diastole, systole, diastole. So like I said, aortic stenosis, crescendo decrescendo, and then mitral regurg is a hollow systolic. So you can see hollow systolic makes the same noise all the way across systole. And then aortic regurg is going to be a decrescendo diastolic, so you can see that getting smaller. And then mitral stenosis, the last one, is a low-pitched diastolic rumble. One other one that's pretty important is the Austin-Flint murmur. This is oftentimes associated with aortic regurg, and that is a mid to late low-pitched diastolic rumble. So associated with aortic regurg, but not to be confused with mitral stenosis. Those are 4 murmurs. So we're going to get into each one separately. The first murmur I want to start off with is aortic stenosis. So when we talk about stenotic versus regurgitant murmurs, stenotic murmurs are chronic and they're not always pathological, they can be benign, whereas regurgitant murmurs are more frequently pathological. So the body's having trouble because of the regurgitation, versus stenosis kind of makes sense. Maybe it's more benign because it's just happening over time, so it's not like, oh, we're dying. So for aortic stenosis, the etiology, there's 3 things. It's going to be a calcium buildup, so the valves just calcify, and that makes it smaller and smaller, the opening the blood can get through. Or the second is rheumatic heart disease, which know that rheumatic heart disease affects all 4 murmurs that we're talking about today. And the third is a congenital bicuspid valve. So the aortic valve has 3 cusps because it's a semilunar valve, but some people are born with just 2 out of the 3 cusps. So that can lead to some problems later on. And note that with the congenital bicuspid valve, you hear a click with the murmur. So symptomology, when it's early stages, the symptoms are shortness of breath and kind of just random ones, non-specific. But when you get into late stage aortic stenosis, which is very bad, that's when you get a really bad aortic triad. And the triad, you can remember she has aortic stenosis, or you can remember aortic stenosis complications. So aortic stenosis complications, angina, and then syncope and CHF. So it makes sense that that's pretty bad because you're passing out and you have heart failure and chest pain. So for radiation, the aortic stenosis radiates the carotids, and management is a TAVR, transthoracic aortic valve replacement. So that's basically open heart surgery is a TAVR. And this will be scheduled. If you're on ICU, this can be an emergent surgery. Say they go in for open heart surgery and kind of screw up your valve, and they have to go back and schedule TAVR, and then you have to go back and get the valve replaced because they screwed it up. So that was the aortic stenosis. Like I said, radiates the carotids, and you have the triad and TAVR. And then the etiology, you can have that congenital bicuspid valve with a click, or the calcification leading to the stenosis. So the next one we're going to talk about is mitral regurg. So we're talking about the mitral or bicuspid AV valve and regurgitation. So that's a leaky, or it's also called mitral insufficiency. So the etiology of this, there's primary and secondary causes. And the primary causes is mitral valve prolapse, rheumatic heart disease, or endocarditis. So something interesting, you can have mitral regurg without prolapse, and same thing, but sometimes if you have prolapse over time, it can cause some leakiness. So make a note of that. And then this radiates the axilla here, so if you're listening below the armpit, you can hear mitral regurg. And then management for this is going to be vasodilators and diuretics. So for the 2 the radiations, I remember Mr. Austin. Mr. Boston. So it's not that good, but it's better than nothing. And then Veronica's gonna explain the next two murmurs.
Hey guys, me again. Between two first. So we're just gonna jump right into the diastolic murmur. And so something you want to memorize with this is a orca. So you have an orca that is wide and it has these big hands, and we'll get into why in just a moment. So to begin with, causes of aortic regurgitation is syphilis and connective tissue disorders. So specifically Marfan's and EDS. With these disorders, you're going to have really large hands and really tall men usually. And so that's why your orca has big hands, due to those connective tissues that causes that. And then there are specific things that you'll see with people who have diastolic murmurs. And so one is demusits, and what that is your patient has a head bob. And then you have Mueller's, and that's where the uvula is pulsating. So you'll be able to see that uvula, it just has a pulse in it. And then Corgan's, which is a water hammer pulse, and you check that by having them place their hand above their head, and you'll feel that double pulse.
It's a regurgitating orca.
Yeah, and it's a regurgitating orca as well. So you're going to have it just like vomiting out. So remember that. And you have a wide pulse pressure, and so that's why you have the word wide inside of your orca, because it's a really wide orca. As far as treatment, you're going to use vasodilators and diuretics. So now we're going to go ahead and move on to mitral stenosis. So you remember this as a mighty stone troll. So this is our troll, and you can see that he kind of has a big head, and he's clicking his left hand. And so causes of mitral stenosis is a myxoma, which is a tumor, and that is why your troll has a large head. You can be caused to calcium, which is typically what's associated with stenosis and causes that hardening. It can also be caused by radiation and rheumatic fever. As Shannon mentioned, rheumatic fever is associated with all of these heart murmurs. And then AFib can also be an association with mitral stenosis. So one thing to know is that it can go from asymptomatic, and then it can cause left-sided heart failure, which then can lead to right-sided heart failure. So over to our troll here, the reason he has the click on the left side is because you're going to hear a click with mitral stenosis, and you can hear the murmur louder when the patient lies on their left side. And then we also have Ortner's here.
Opening snap.
An opening snap, not a click, I apologize. We also have Ortner's syndrome here because your troll has a hoarse voice. And Ortner's is where you get impingement of your laryngeal nerve that causes the hoarseness. Ortner's syndrome. As far as treatment, this is typically done with a balloon that they go in and just kind of pop that valve open. But for our purposes here in this class, we need to know a commissurotomy is what's going to be the treatment for mitral stenosis. So thanks again for tuning in. Don't forget to check us out. Give us a like and subscribe to our channel. Leave a comment below. Thanks.